The warmer, humid summer is upon us, and that doesn't just bring outdoor fun, but also a variety of insects like mosquitoes and ticks, which may pose an increased threat this summer. For more, we're joined now by Dr. Isaac Bogosh. He's an infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, Manitoba is reporting the first pool of mosquitoes carrying West Nile virus. What's causing this earlier than usual discovery?
Well, thanks, Neil, and happy Canada Day long weekend. And I think, I know we're going to talk about mosquitoes and West Nile and ticks and whatnot, but I think it's important to remember that we of course, are blessed with beautiful summers in Canada. I hope everyone goes outside and enjoys it. But of course, we know there's more insects around, and some of these insects can transmit infections. And there's just simple precautions we can take to protect ourselves from getting infected and from getting bit. With West Nile, usually we see it in the tail end of the summer and into the early fall. There's areas that have pooled water and are breeding grounds for mosquitoes. We'll obviously see a greater mosquito population and infections transmitted by those mosquitoes. West Nile is usually amplified in bird populations and carried by migratory birds. And it looks like because of our climate, our weather patterns that we're having this year and general trends, we might start seeing earlier cases of West Nile. Manitoba is seeing that right now. Doesn't look like there's much West Nile elsewhere in the country, but it's something that we need to keep an eye on.
Now, health officials are saying the risk of exposure to West Nile remains low. Are there any factors to consider that could likely change this in the next few weeks?
Yeah, that's a good point. And certainly there's very little recorded in Canada at the moment, but it is amplified in bird populations. There's decent surveillance for this infection across the country. And if we see more mosquito populations and greater breeding grounds for mosquitoes, which is stagnant water and water pooling in areas where the mosquitoes can lay their eggs and breed, we'll probably see more mosquito-transmitted infections, including West Nile. Typically, it's at the end of the summer, but we might start seeing it early on this year. It is a bit of an abnormal year, and that's why mosquito control efforts are so important, and also protecting ourselves from mosquito bites is important as well.
For the first time in decades, the U.S. Centers for Disease Control is warning of some locally acquired cases of malaria in the United States. What triggered this warning?
Yeah, this is fascinating. The United States hasn't had locally acquired malaria for about 20 years now, and then there were some cases that popped up locally in Florida and in Texas. Usually we see malaria in Canada and the United States from returned travelers. So what's unique about this is people caught malaria while not having left the state of Texas or Florida. And really what they have is the convergence of many things. You have the right mosquitoes there. They're called Anopheles mosquitoes. You have the right climate conditions, which is warm temperatures both during the day and the night. And then you have the importation of malaria from travelers. So people have to have the parasite in the blood. They get bitten by a local mosquito, and then that local mosquito can process the infection internally and then transmit it to someone else. I'll remind you too, and I'll remind viewers, that Texas and Florida also had locally acquired dengue virus recently, and those are transmitted by different mosquitoes. And in 2016, they both also had locally acquired Zika virus. So the climate conditions in Florida and Texas and other parts of the southern United States are amenable to transmission of local infections that we would consider tropical infections, but they are creeping northward.
Almost makes you want to stay indoors in the air conditioning all summer long. Now, malaria is an infectious disease, so could it be spread through casual contact like other infectious diseases?
Absolutely not. The vast majority of malaria is transmitted by the bite of a female Anopheles mosquito. These are mosquitoes that like to bite during dusk and evening times. And remind people that malaria is a very serious illness. It can cause very serious sickness. And if people are traveling, especially to tropical areas or subtropical areas where malaria is transmitted, it's very important to go seek pre-travel advice, talk to a healthcare provider, because many people may end up going on malaria prophylaxis, a pill you might need to take to prevent a malaria infection while traveling abroad. So it's very important to seek pre-travel advice to get the right health information, not just to prevent from malaria, but from other infections along the road.
Now, I don't know if you've seen these ads on Instagram, but they've got these like mosquito zappers or these kind of like high-tech solutions to prevent mosquito bites. Are those effective? What are some of the ways that we can prevent being bitten by a mosquito?
Yeah, simple things like preventing them from getting in the house for starters. So putting screens on the windows and screens on the doors is very helpful. They won't bite at night if you're really in a good air conditioned room as well. And simply when we go out, we can use mosquito repellents as well. 30% DEET or 20% icardin. It's written right there on the bottle. There's multiple products available. Those are very good products that actually last several hours while you're wearing them. I mean, there's a million products that are available, but the DEET and icardin actually last for hours. And of course, you need to reapply them if you get out of a pool or a lake or an ocean. But also, you might need to reapply them if you're sweating, if it's pretty hot outside. Sometimes you'll hear people say, well, wear long pants and long sleeves. And sure, that's going to help prevent mosquito bites. But of course, it's summertime and it's really hot, so it's not always that practical. But again, those products that contain DEET 30%, icardin 20% are usually very effective. You just have to reapply them periodically.
Okay, and before we go, one more plague or pest, Lyme disease. Here at home, cases of Lyme disease caused by tick bites are on the rise, partly because there are a lot more ticks. So why are ticks and the disease that they carry spreading now?
Yeah, unfortunately, with the impacts of climate change, we're seeing a larger geography inhabited by insects, ticks, mosquitoes, that can transmit these infections. So not only is the geographic range larger, but the season in which they can transmit this infection or these infections is also larger as well. Canada reports between 2,000 and 3,000 cases of Lyme per year. That's probably a gross underestimate. We probably are seeing a lot more cases than that. And again, it's beautiful outside. I hope people go outside and enjoy the summer. It's wonderful. But again, you can put on some bug repellent to prevent tick bites. You can wear long pants to prevent tick bites. And it's important when you come back from wooded areas or areas with tall grass where we know ticks like to live, just do a tick check. Look over your body, have someone look around the back of the legs as well, where you might not be able to see, and you can easily remove those ticks. If people want to know how to remove the ticks, you just use tweezers and pull up, make sure that none of the ticks left behind. You can go online. There's a million tutorials online, including the Public Health Agency of Canada, demonstrating the right technique to remove a tick.